You hear a doctor talking to a new patient called Miss Taylor about her gastrointestinal issues. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, Miss Taylor. Please have a seat. So, this first consultation is primarily for me to understand the full picture of the issues you've been having and, try to figure out a clear direction for treatment.
Thank you, Dr. Brown. I'm glad to finally be here. It's just, this stomach trouble is really getting me down.
I understand. We'll certainly look into it. So let's start with some basics. Could you tell me about your work? What do you do for a living?
Well, I work as an elementary school teacher. I teach grade 4. It's quite demanding, lots of marking and standing on my feet. I'm full-time, but I often take work home, which means long hours.
Right. And now, about the main reason you're here. Could you describe your current gastrointestinal symptoms for me?
Okay, it's mainly a very persistent bloating feeling, which is worse after I eat. And I have these intermittent bouts of diarrhea that can be really unpredictable. Sometimes there's also quite a lot of abdominal pain, especially on my lower left side.
I see. And when did these symptoms first start to trouble you?
Oh gosh, it's been going on for I'd say about 6 to 7 months now. It used to come and go, but in the last 3 months it's been pretty much constant. It's really affecting my ability to, feel comfortable teaching.
Has anything you've tried recently offered any relief? Have you made any dietary changes?
I have, actually. I cut out dairy products completely about a month ago, thinking that might be the culprit. Unfortunately, that hasn't helped at all. I also tried an over-the-counter anti-diarrheal, Loperamide, a few times, but it just made the bloating worse, so I stopped.
That's useful information. Now, regarding your medical history, do you have any known conditions or allergies I should be aware of?
No major conditions. I did have my gallbladder removed about 10 years ago, but no issues since then. I also know I have a severe allergy to sulfur drugs. They cause, immediate swelling, so I carry an EpiPen just in case.
Noted. Thank you for telling me. And are you experiencing any other symptoms, like have you noticed any unexplained weight loss or blood in your stool?
No, thank goodness, no blood. But I have dropped maybe about 3 kilos over the last 2 months without trying, which made me a bit anxious. My appetite is okay, though.
That's understandable. We need to investigate that weight loss. Just before we move on to testing, what is your stress level like, given the long hours you mentioned?
Well, I'm quite a nervous person generally, and teaching is stressful. The unpredictable nature of the symptoms definitely makes my anxiety levels worse. I often feel quite tense in my stomach.
I see. Based on your symptoms, the location of the pain, the unpredictable bowel habits, and the duration, I think the next sensible step is to rule out inflammatory issues. I'd like to arrange for a Faecal Calprotectin test as a starting point. This will give us a better idea of inflammation levels in your gut. How does that sound?
A fecal calprotectin test? Okay, is that complicated?
Not at all. It's a simple stool sample test, and we'll send it off to the lab. We should have the results back within a week, and then we can discuss the next stage, potentially a referral to a gastroenterologist if needed.
That sounds like a clear plan, thank you.